concussion is any injury to the brain that affects the way the brain functions. You do not actually sustain structural damage to the brain, but the brain just doesn't quite work the way it used to.
It doesn't even have to be a hit to the head. It could be a fall into a whiplash type injury, the kid falling in a field. But if that brain slides around inside the skull, it's called a coup contre coup kind of slide where it hits the front, hits the back end. There's a chemical change that occurs. It doesn't allow those neurons to fire correctly, and then you get the symptoms from the concussion.
There can be multiple effects of having a concussion. Some are short-term, some are long-term. Short-term effects can be headache, blurry vision. There's a lot of different neurological symptoms that a person can get. And we hope that by treating concussion well that there aren't any long-term symptoms, but there can be memory issues, long-term chronic headaches.
They may be complaining of dizziness, headache, nausea, visual problems, sensitivity to light, sensitivity to noise, but any kind of neurologic signs, symptoms, you have to be suspicious.
When you have a concussion, what happens is you have a disruption on the cellular level within the brain. Now, the brain cells normally allow nutrients and minerals to move into and out of the cell, such as potassium or calcium, for example. And in a concussed brain, that normal equilibrium is disrupted, resulting in a lot of the symptoms you see. Secondly, the blood flow to the brain is diminished to the injured part of the brain. One thing the blood does when it flows to the organs is provides it with those various nutrients that it needs, such as sugar or glucose. And that's brain fuel. So you have a moment in time where the brain demands for recovery are at its greatest during a concussion, but you're limiting the supply of that brain fuel. So that further leads to the cellular dysfunction that you see in a concussion.
For the most part, it's a serious injury, and that if you don't get them treated appropriately, they can lead to some long-term injuries and long-term symptoms. On the other side of the coin, though, is that if you get the concussion managed appropriately early, that 80 to 90% of them resolve in 10 to 14 days.
We learned a lot more about concussions recently looking at the brains of football players, that we have their documented concussions on video, and have found that there is a lot more long-term effects, especially of concussions that were missed or gone untreated, and then patients get more and more concussions that build up and causes actually long-term brain damage.
When in doubt, sit them out.
What we're doing is looking to see if your pupils track even or your eyes are tracking even without bouncing at the end range of motion.
If there's any concern about the concussion or a concussive type of injury, you want to make sure that you get protected and get evaluated quickly, because if you don't, symptoms can last longer, you can have more long-term effects, and there's always this risk of something called second impact syndrome, which nobody wants and can lead to some catastrophic injuries.
Next thing we're going to do is I'm going to test balance, okay? Last little thing we're going to do today, what I want you to do first is stand with your feet together, hands on your hips. If you want to bend your knees a little bit, you can. What I want you to do is when I tell you to, close your eyes, and I'll tell you when to open them.
The thing I think we want to do with concussions is to recognize when they occur. And when they occur, seek the appropriate medical attention so they can be treated properly to determine when is it safe to actually go back to playing sports. And if we do that, we don't need to be afraid of concussions. We just got to be able to acknowledge when they occur, how to treat them, and when to safely go back to play.
Hi, I'm Dr. Mark Bradley.
Hi, I'm Dr. Aaron O'Toole.
Hi, I'm Dr. Jennifer Sheeler.
Hi, I'm Dr. Goran Yankovic,
We are the Concussion Care Network.